Hello everyone, Justin White here, CEO and founder of Senior Health Services. Welcome to Medicare Monday. Appreciate you talking to us today and coming by and spending some time. So there's an age-old question that we go through all the time. Which one should I go with? Should I go with a Medicare Supplement or should I go with a Medicare Advantage plan? That is the first thing that we deal with when you come to see a Senior Health Services agent, is trying to figure out who we're talking to, because people don't just, it's not an arbitrary thing. You either belong to a supplement or you belong to an Advantage plan, in my opinion. It's a style of care thing. So whenever you're out there and you're trying to make a decision about which way to go, like everybody is when they're turning 65 or retiring, you've got to remember that ultimately it comes down to how you want it to go. What is the expectation that you have of your plan? You can go to Facebook or you can go to friends and family and you can go to doctors, and you are going to get so many different opinions, and they're going to be hard to dig through. And just because what one person's preference is, just because they say that and they believe it very strongly, they've got all this stuff to back it up, does not mean that's what's the right plan fit for you. Okay, I had a gentleman come in here yesterday. He had already purchased one of those, and in talking, I found out that an agent had put him there, not ours, put him there without really going through and asking the questions. The agent really did a crappy job. And as it turns out, he pulled that product, he withdrew the application, and we put him into what his preference actually was, and they left a lot happier and a lot more comfortable. They came in to see me because they just felt uncomfortable with how quickly they were rushed into something without really taking time to vet and figure out exactly what the fit was, okay? There's a lot of stuff going on around there. You go into Facebook or you go online and you Google Medicare Advantage or you Google Medicare Supplements, and man, you are going to be beat to death with all the options and the opinions. There is a lot of stuff going on around about there. There's hospitals and doctors fighting with Medicare Advantage, and there's people complaining about the premiums on supplements. Let's face it, there's no perfect thing. Each one of those options, supplements and Advantage, are both flawed in their own way, okay? They are not perfect. The supplements have premiums, and generally those premiums go up every single year, and eventually for most people they start getting a little expensive. They also don't cover any extra things. There's no dental, there's no routine vision, hearing, nothing. It's hospital and doctor and preventative is what supplements do. They do a great job for what they do, but it's not the fit for everyone. On the Advantage side, they're the PPOs and the HMOs. Sometimes you need referrals, sometimes you don't. Sometimes you're going to be dealing with pre-authorization, many times you're not. It just depends on what the rules are and what's going on and how the doctors code it. Some people really hate the idea of having to get a referral. Other people are like, care less. I mean, I'm getting referrals now and it works fine. The key is, do you like your primary care physician? That's the key to those things, because they're the ones that are sort of sending you off and making the referrals happen. And if you don't want a referral, we go with a PPO. If you don't mind the referrals and you like more benefits and things, then an HMO might fit the bill. But bottom line is, it's the style of care, right? If you don't want to pay anything and you don't mind paying the co-pays and co-insurance like you have, and you understand, yes, there might be a few restrictions on where you can go, then an Advantage plan may fit well. If you're like, look, I don't want to talk about any of that stuff. I've got the money. I don't mind spending the money because I know what I'm buying. I'm buying convenience. I'm buying access. Then a supplement might fit the bill there. But people are very opinionated on each one. And at the end of the day, the one that fits you is the one that you look at and say, you know what, I don't want to spend all that money. Or yes, I do want to buy access. Right? At the end of the day, you need to sit down and talk with somebody about it, because we get very few complaints about both. Regardless of what you read online, people love their supplements. And Medicare Advantage, despite some of the press that goes on sometimes, we get very few complaints, and they are generally very popular, and more people are in Advantage now than supplements, right? But they're both great. Okay? If you have any other questions, call us at Senior Health Services. And thanks again. This is a little bit longer Medicare Monday, but we appreciate having you here. Give us a holler, 281-894-7540 if we can help you. Otherwise, we'll see you next week. Bye-bye.